concerns again over those with early stage pneumonia. Dr. Pinto, can a 6-minute walk test help identifying early stage pneumonia among patients being treated at home? What are you recommending, Dr. Pinto, for those who may have early stage pneumonia, in identifying early stage pneumonia?
At the outset, if you have an oximeter, the baseline oxygen saturation alone gives you a lot of information. And if you look at the science, a lot of the studies that have been done, a lot of the drugs that have been tested based on that simple oximeter done at rest. Of course, using a test like a 6-minute walk test essentially means that you're putting your system under demand for more oxygen. So when you walk, your body needs more oxygen. And if your lungs are affected enough, the lungs will not be able to provide that increased quantum of oxygen that the blood requires. So a 6-minute walk test could pick up signs of deterioration at a slightly early stage. It's not necessarily been validated that because a 6-minute walk test is showing a drop in oxygen saturation, therefore you need to do something differently. I would keep the person under a closer watch, under a closer radar, but unless the person still meets the necessary criteria. For example, I would start steroids only when the baseline oxygen levels drop. I would not start it in anticipation of the oxygen levels dropping unless I'm absolutely convinced that this is towards the end of the week, the first week, everything else is pointing in the same direction. There's a strong fever, the person is coughing more than before. And like was said before, unless the patient clearly looks like he or she is deteriorating, I wouldn't be in a rush to start steroids purely based on a 6-minute walk test. But of course, it's a useful monitor to try and kind of realize who are the individuals that you need to keep under the radar.
Right. But I want to link this to a question that is being asked again by several people, Dr. Pinto. How can we reduce complications and deaths among under 45 patients? We've seen with COVID 2.0, a lot of people in that age group of 30 to 45 getting affected, and some of them sadly passing away. So I want to understand from you, how do we reduce the complications? You're saying steroids have to be administered at the right stage, not too early, not too late. But what do you recommend, Dr. Pinto?
So unfortunately, I see the prescription of steroids too early very often. And unfortunately, this demographic in whom it tends to be prescribed too early very often ends up being young individuals. So young individuals, by virtue of having a very robust immune response, by having a very strong immune response, tend to have very high fevers in the first few days. So it tends to be 102, 103. Very often they've been prescribed a cocktail of drugs which may not necessarily be the right thing. But despite that cocktail of drugs, which possibly don't have an effect on COVID, and therefore the fever still persists on day 3, day 4, makes these individuals extremely nervous. So they see they're still having 102, 103 degree fever. They are otherwise fine. Their oxygen levels are fine. They seem fine from all other aspects, except the fact that they're having this high fever. And this high fever then drives them to probably tell the doctor that the doctor needs to do something. The doctor feels tempted, therefore, to fix it in some way. And this is when steroids get prescribed very often on day 3, day 4, in the early course of the disease. Now, we know that the early course of the disease is the time when the body is mounting an immune response. And this immune response, let's be clear, this immune response for 85% of individuals is good enough. 85% of individuals will have this fever for 4 or 5 days, sometimes for 6 or 7 days, but will heal by themselves. Now, if you blunt this immune response at this stage by giving steroids, which are immunosuppressive drugs, which reduce your immunity, there is a very good chance that you will deteriorate, that the virus will now have a free hand to multiply. And unfortunately, this does seem to be the story for a lot of young people who come to us in the second week in a pretty bad shape. When we go back and audit their prescriptions, I've seen it more often than not that these are the individuals who've received steroids very early on. So I think, one of the things that we really need to do to protect young lives, is possibly not to react to just strong fevers and have a solid reason to give steroids if we prescribe them in such individuals.
I think you've made a very